There is no standard rhinoplasty operation. Each patient, each face, and each nose is considered to be a whole and has a different anatomical structure and is unique to itself. It therefore requires separate planning for each patient for rhinoplasty in Istanbul, Turkey. A complete determination of aesthetic and functional deformities, good design and surgical planning, ability to perform it, and most important experience is required. A balanced nose is aimed at every aspect and looks good in other aspects of the face. The artistic skill of the surgeon, the training and experience of nose surgeons, the desire for self-development are the most important factors for a successful outcome. In addition, the balance of aesthetics and functionality must be well preserved. Today, many physicians seek minimal traumatic procedures, avoid excessive resections and rhinoplasty operations, try to preserve structural support, and try to achieve a natural outlook throughout their lives. As a classical knowledge, two different rhinoplasty techniques, namely open technique and closed technique, are divided into subgroups such as ultrasonic rhinoplasty, microscopic rhinoplasty, preservation rhinoplasty. According to the instruments used and bone-shaping techniques, there are rhinoplasty techniques and names that can be separated. I generally prefer the micromotor-assisted open technique rhinoplasty method. I can use bone-cutting techniques with an ultrasonic device during the procedure. Here, it is best to leave the choice of technique to the surgeon who plans to perform the rhinoplasty operation and to act according to his choice. Although there is no skin incision scar in the columella and closed technique rhinoplasty operations, the surgeon's dominance of anatomical details is not as much as an open technique rhinoplasty. In particular, there are many advantages of the open technique in revision nose aesthetics with advanced septum deviation, nose aesthetics with excessively thick skin, and crooked nose aesthetic operations. Nose shape and structure can be varied depending on the characteristics of the racial and geographical features. It is important that you have a detailed conversation with your surgeon before the operation, skin, cartilage, and bone analysis, and your doctor's opinions. In fact, simple in the name does not mean that this is not a preoperative surgery. Aesthetic nose operations, which are simpler than other rhinoplasty operations. In particular, it consists only of a limited combination of nose hump reduction, nose tip plasty, and nose-forming processes without bone fracture. Rhinoplasty, which is a special operation, can also be performed as a personalized procedure in this way as a limited amount of operations.